Okay. Um, so welcome you all to this meeting of sample questions. This meeting is intended for all those who are participating in the pathology quiz on the coming 31st of August. Atharva Pandey, co-founder president, could not join us due to some work of his. So I invite Susmita Gokhale, vice president, to speak a few words regarding the society and the upcoming pathology quiz, as she was not there in the last meeting due to her exams.
So hello, this society, the Quizzing Society, was founded by Dr. Amir Munimani, our president, and Atharva Pandey, our co-founder president. So this Quizzing Society is aimed at fostering the knowledge and critical thinking that is required during giving any quizzes. So they say that you can't like prepare for any quiz, but you cannot predict questions that can be a part of the quiz. But being a part of the society will help you like be on your toes during participating any other quizzes. So it is about like not just about knowing facts. It is about learning how to connect the various ideas and the knowledge that you already have to solve a particular question. This society, we are going to conduct various quizzes in different months. So we have been uploading pathology snippets for the upcoming quiz on the 31st of December on our YouTube channel. So those who have not seen it can please go and see, and also please subscribe to the channel. Uh, as for meeting. This meeting is about, it is just like an overview for about what the quiz on the 31st of August is going to be. So now I'll give it over to Amin.
Yeah. Okay. So, I mean, firstly, this quiz has been set according to AFMC standards. In the past 2 3 years of my little quizzing experience that I have gathered, I have participated in various quizzes in AFMC, both general knowledge as well as medical quizzes. In that, I found that they are not asking one liner questions like I saw in other quizzes in BJ or in other colleges like Kashibai Navle. Those quizzes are proper quizzes. It really takes a lot of efforts to set those lengthy questions. uh, those who have experience will know it for sure. So this is a unique thing that we at Bharti are doing. Actually, nobody actually does this, that before a quiz you are conducting a meeting so that people actually know what type of questions they are expecting. According to that, they can prepare. As Susmita has rightly said, you can't prepare for a quiz, but you can definitely revise whatever you know already in a proper direction so that it can help you to perform well in the quiz. So we'll be starting with the sample questions, and exactly as per the quiz, I'll be asking you. Any of you can unmute and tell the answer, or you can comment on the chat box, whatever is suitable to you. So we'll start with the sample questions of prelims. So in prelims, we have direct questions, one-liner questions, theoretical questions. Nothing tough in that actually. The first question is, and your time starts now, 30 seconds. T helper 1 is involved in which type of hypersensitivity? So anyone can unmute and tell the answer, or you can type in the chat box. Okay. I think nobody. Okay. Yeah, I've got an
I
answer.
think
Type 4. Yeah, type 4 is the correct answer. Okay. Good. Moving on to the next question. I'm not going to explain any prelim questions. They are direct theoretical questions. Who discovered the transmission of malarial parasite is by mosquitoes? Again, your time starts now. Please accept. 30, 30 seconds are over, I guess. So the answer to this question is, so, yeah, correct answer. Ronald Ross. Very good. Moving on to, so as you must have got a idea, the prelim round is a factual round. It won't be having any difficult questions. Simple theoretical one-liner questions. Now moving on to the finals. In the finals, we have divided the quiz into 6 rounds. The first round is the clinico-pathological correlation, in which questions are set as per clinical vignettes. All these clinical vignettes are taken from your previous year entrance exam questions of Indian exams as well as foreign exams. So the setting will be a clinical question will be given and a pathology based question will be asked. So for example, see this question on the screen. A 12-month-old infant with a history of recurrent infections, eczema, generalized edema and bruising is diagnosed with an X-linked recessive congenital immunodeficiency. CBC shows thrombocytopenia. What is the most likely diagnosis? Your time starts now. Okay, we have good number of participants. We have 21 people in the meeting. That is pretty impressive compared to the last time. I guess 30 seconds are over. So the answer to this question is Viscott-Aldrich syndrome. The answer is Viscott-Aldrich syndrome because if you have read in your immunology in Robbins, Viscott-Aldrich syndrome is a triad of immunodeficiency, thrombocytopenia, and eczema. And all these three conditions, all these three words were given in the question, which was a direct pointer towards the answer of Viscott-Aldrich syndrome. Moving on to the next question. Yeah. So round 6 is going to be the most interesting round. This round has got the maximum weightage after rapid fire round. And this round has nothing to do with how good you are in pathology. This is a trivia round. So trivia is anything that is general knowledge related to pathology. It is basically not at all, these questions will not at all come from your standard textbooks. It is just for fun. So in your quiz, you will be getting 45 seconds for this question. And the marking scheme is plus 25 for correct answer, minus 25 for wrong answer. If the question gets passed, it will get passed to the next team in clockwise order. Still, the marking scheme remains plus 25, minus 25. So reading this question, he was a German neuropathologist born in Breslau. He received his medical doctorate from the University of Munich in 1893. He learned histological staining techniques from Carl Wigert. Later in his career, he worked at the psychiatric clinic at the Cajal Institute in Madrid. He made important contributions in tuberous sclerosis, paralysis agitans, Huntington's chorea, and myotrophica congenita. He is remembered for his histopathological work with disseminated sclerosis, the use of a histological silver stain for impregnation of nerve fibers. Now there is a silver stain which is after his name. So who is this pathologist? Such questions I have seen in all AFMC quizzes. They are very tough. So try to answer this question. 45 seconds start now. Okay, for the recording, na? Fine. Okay, so just show the answer. Acha, acha, meeting only. Okay, show the answer. The answer is Max Belchowski. Fine. Moving on to the next question. Round 3 will be taken by Susmita.
So round 3 will be true or false. So the question is Marfan syndrome is caused by mutation that disrupts the primary structure of fibrillin and blocks its assembly into microfibrils. So like this question is in two parts, so you have to like read it properly to answer. Does anybody want to answer? Can answer in the chat box or can unmute themselves.
I think since we have shortage of time, we'll tell the question and the answer together.
Okay. So the answer is false because in the second part of the question, it is said that one second that it disrupts the primary structure of fibrillin and blocks assembly into microfibrils. So the it does not necessarily block the assembly into microfibrils. The fibril that is fibrillin protein that is formed is itself wrong in structure. So the assembly of the microfibril gets disrupted. It does not block the assembly.
Okay, so round 5 is rapid fire. Here you will be asked 10 questions and you have to answer them in a span of 1 minute. So the first question, and it will be according to the team. So team A will get 10 questions, 1 minute, then team B, and followed by that. So first question is vinyl chloride is a carcinogen for which malignancy? And the second question is transmural inflammation with non-caseating granuloma is seen in which form of inflammatory bowel disorder? I think second question is pretty easy. First question I think is a little challenging. Not much. Show the answer. The answer to the first question is hepatic angiosarcoma, and to the second is Crohn's disease. Very obvious. Moving on to the next question. Very interesting. This is connect the dots. Now, this is also, I have taken this type of questions from AFMC. The question will have 2, 3, or 4 images, and you'll have to connect the dots and give the diagnosis. So, the first image is a gross specimen of testis, and the second image is an image of a potato. Now, you have to connect these images and come to a diagnosis. You'll be given 45 seconds in the main quiz. So, just show the answer. This is seminoma because um, seminoma has a cut potato appearance on on gross. So that is why the answer is seminoma. Moving on, round 2 will be taken by Susmita.
So round 2 we'll be showing you pictures of slides and you have to describe what the slide is showing. So in this case, this is the picture of a slide of amniotic fluid embolism. It will show some lanugo here and it will show
Vernix caseosa.
So this is the last slide of the.
So this is how the questions will be in the final quiz. I hope you have all got the idea. I'll repeat it. Prelim will be factual. Round 1 will have a clinical question. Round 2 will have a slide. Round 3 will be true or false. Round 4 will be connect the dots. Round 5 is rapid fire and round 6 is trivia. So I guess this was all that was planned for the meeting. Thank you. I request everyone to turn on their cameras because this is going on YouTube. So, and I request the IT heads to take a photo. अच्छा सब छोड़ के जा रहे हैं अरे रोहल ओह 10 minutes तर काय करणार जॉईन करून आय सेड टर्न ऑन रे नाही 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 टर्न ऑन द कॅमेराज सो दॅट इट्स गोइंग ऑन युट्यूब ना तो सगळ्यांचा फोटो जाईल बाकी काही नाही पण कोणी करत नाहीये माहितीये का दे आर लाईक कशाला इट्स मी सुस्मिता आय थिंक आणि अजून एक मुलगा आहे साकेत वॉट एव्हर पण आपण येऊ का एक फ्रेम मध्ये ओ नाही पण झूम वर कसं आहे तुम्हाला फक्त तुम्ही दिसता असं आहे म्हणून ते कधी कळतच नाही की काय चालू आहे आणि आता तर पीपीटी चालू होतं तर मला मी पण नव्हतो दिसत सो या राईट 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 नाव जस्ट क्लिक द फोटो आय थिंक या फाईन फाईन एनी हाव या थँक यू एव्हरी वन या थँक यू बाय बाय